Jill is a 54-year-old female who is being seen for a follow-up visit related to her hypertension. She also presented 6 months ago with a fractured arm from a fall on her steps. During this visit, Jill scored in Zone 3 on the audit, the harmful category.
So Jill, I know you're here to talk about your blood pressure today. Before we get into that, I see you filled out our annual screening forms here. So if you're okay, can we take a minute to talk about that?
Sure.
Okay, great. It looks like the way you filled out the alcohol form puts you into our third zone of drinking. Can you tell me a little bit about your drinking habits? Where you drink? What do you like to drink?
I drink wine mostly. Okay. I go down to the little pub down the street. Mm-hmm. Have a few glasses of wine.
Okay. Kind of socializing.
Mm-hmm.
All right. How often do you do that?
3 or 4 times a week, probably.
Okay. And in a regular night, how many glasses of wine would you guess you drink?
3 or 4 or 5.
Mm-hmm.
Maybe on a weekend, maybe 6.
Okay.
Over a period of time.
Mm-hmm. Okay. So let me just show you on this card here. From a medical perspective, we know that there's good evidence that shows that women your age who drink more than 3 drinks on any one occasion, at any sitting, or more than 7 in a week, are likely to run into health problems from their drinking, either problems they're having right now or maybe in the future.
Are you serious?
Yeah, surprising.
7 drinks in a week doesn't seem like that much.
It sounds like you're drinking a bit more than that right now.
Yeah, I didn't think it was much, but that makes it look like I'm drinking way too much.
Mm-hmm. From this drinker's pyramid over on this side of the card, you can see that the score on your screening sheet shows that you're up in the harmful category of drinkers. So that it's likely you're drinking, in quantities, probably more than about 90% of the folks who come in to see me here at the clinic.
Well, I know my drinking has increased a little since I got divorced and moved to Portland, but I don't think it's that much of a problem.
It doesn't feel like a problem to you right now.
Yeah. No, not really.
Yeah, okay. And then the other thing I should mention, Jill, drinking more than these quantities, it's possible it could be pushing your blood pressure up a bit, and I'm wondering if that might be affecting the difficulty we're having getting your blood pressure down right now.
I didn't realize that drinking had anything to do with blood pressure.
Mm-hmm. Yeah, it can sometimes.
Oh, well then, I guess that could be a problem.
My perspective as a doctor, it would be good if you could think about cutting back a little bit or doing something different about your drinking. What do you think about that?
I guess I could cut down some.
Okay. So on a scale of 0 to 10, 0 being not ready at all to do that and 10 being very ready, where would you lie on that scale?
I'd probably a 6.
Okay. Okay, so I think that's great. So why would you be up at a 6 and not down at a 2 level? What kinds of things would push you to be up there?
Well, I didn't realize that drinking was related to my blood pressure problems.
Yeah.
And I did fall earlier this year on my way home from the bar and hurt my shoulder. I don't think the drinking made me fall, but it probably didn't help the situation.
Okay.
And well, my son keeps telling me that I'm drinking too much. And it's scary to think that my drinking is harmful. That's a big word.
Yeah, yeah. So you've got some good reasons to try to cut back a little bit.
It sounds like it to me.
Yeah. And it sounds like you're willing to maybe try not going to the bar quite as much and maybe drinking a little bit less when you go to the bar?
I think I can try to do that.
Okay.
Yeah.
So to what levels do you think you could do that? Where would you want to go with your drinking?
I guess I could use those numbers, and I can't make any promises, but I could try to drink less than 3 in a night and less than 7 in a week.
Okay. Okay.
That mean I could only drink 2 or 3 times a week.
Mm-hmm. So you would drink maybe just a couple times a week and maybe a little bit less on each occasion? Is that what you're saying?
I can try that, yeah.
Okay. Okay.
I don't think I need to quit, but I think I can try to cut down.
And you think you're able to cut down to those levels of no more than 7 a week?
That's what I'll shoot for.
Okay, I think that sounds like a great step for you as your doctor. Why don't we revisit this the next time you come in to talk about your blood pressure in about 6 weeks or so, and we can see how you're doing with it.
Okay.
All
Sounds
right.
good.
Well, let's get back to your blood pressure then and see what we need to do about that.
Okay.